So, as we all know, urinary incontinence is quite a common urological symptom. It's common in both children and also in adolescents. The previous study says that the prevalence of the urinary incontinence decreased with the increase in age. However, if the adolescent have the urinary incontinence, they can have the more frequent and severe type, and obviously it can cause a significant impact on their quality of life. So that's the reason we would like to learn more about the adolescent incontinence. So we perform a retrospective medical record review of the patients who attended the bladder clinic for 10 years period from 2005 to 2014. We compare the adolescents who are age 15 and above at their last visit with the younger patients, and we match them by the gender and year of presentation. We collect the data from the standardized assessment form, which the clinician need to fill at the first visit. And we statistically we use a binary logistic regression analysis, and we compare the presentation between the two groups. So first of all, for the age of presentation, what we found is that adolescent patients present later compared to the younger children, and it is also statistically significant as well. However, there are some patients who present early in the adolescent group, which reflect the patient who developmentally delayed or chronic complex patient already well known to the hospital. That's the reason that they refer early to the service and seen in the clinic. For the data for the achievement of the daytime toilet control is not much significant between the two groups. However, the only thing is that the number of patients who achieve the toilet control later, that is more than 5 years, is more in the adolescent group compared to the younger children group. For the achievement of their bowel control is not much significant between the two groups. For the other chronic illnesses, what we found is that in the patients with their developmental delay are more in the adolescent group compared to the younger children, and it's also statistically significant as well. For the other chronic illnesses, there are much more patients with a chronic illness in the adolescent and compared to the younger children. However, the number is quite small, so we don't have the p-value here. Also, for the type of the urinary incontinence, we classify nocturnal enuresis and daytime urinary incontinence. And we further classify into monosymptomatic and non-monosymptomatic, but it's not significantly different between the two groups. Also, similarly, for the primary and secondary type of the nocturnal enuresis, it's not significant between the two groups. For the daytime urinary incontinence, the numbers are not different between the two groups as well. At the bottom row, there's a group called neither, which means is that there are patients who refer to the bladder clinic for other lower urinary tract symptoms, like the urinary urgency or frequency or recurrent lower urinary tract infections. However, it is also not significant between the two groups. We classify the severity of the nocturnal enuresis according to the ICCS 2014. Patrina mentioned that before. It's say significant if it is more than one episode of the wet in a month, and further classify into frequent and infrequent type. Frequent is more than or equal to 4 episodes, and infrequent is less than 4 a week. However, the good thing that we found here is that it's not significant between the adolescent and younger children. Also, similarly for the daytime urinary incontinence, we found that the severity is also the same. For the number of visits, what we found here is that adolescent group have much more number of visits compared to the younger children, and it's also statistically significant as well. For the status at the last visit, we found out how many patients get dry and get discharged from the service. And we found a very good thing here that adolescent group get dry and get discharged from the service more or less similar to the younger children. It's not statistically significant between the two groups. So just to summarize my data, what we found from the analysis is that adolescent group present later, and they have more patients with a developmental delay in adolescent patients. However, they are responding well to the treatment and doing well similar to the younger children. So that's a message that we would like to give to the primary caregiver and families that although the adolescent group are doing much, also doing well similarly to the younger children group. So we should encourage their families to seek their medical treatment earlier.
She did it to time. Any questions for Thet and her study? Can I say that the low cure rate at discharges because a lot of people don't come back when they're dry. So we just sort of documented what was at the last visit. So I actually think we're much better than that. I think that's not biased. Any question for Thet or me on this research?